Welcome back to Drugs and Behavior with Dr. Goodin. Next we'll be talking about Chapter 10, Nicotine and Tobacco Use. Like alcohol, nicotine and tobacco have historically enjoyed social acceptability. However, despite negative health effects of alcohol, it is still seen in a much brighter light. Christopher Columbus was given tobacco leaves in 1492 by the American Indians. Two members of his expedition went to Cuba and discovered tobacco drinking, or as we know it, smoking. One sailor exhibited his new ability to breathe smoke out of his mouth and nostrils and was considered to be possessed of the devil. He was accused of witchcraft and imprisoned in the Inquisition. The French introduced tobacco from the New World to Europe, specifically to the Queen of France, as a possible treatment for her migraine headaches. The man who did it was named John Nicot, and nicotine was named after him. Smoking tobacco became fashionable among European aristocracy. King James I of England condemned tobacco use as ugly and harmful. Harsher penalties for smoking tobacco were used in Russia, Turkey, Japan, and China. When the Sultan of Turkey became a smoker, penalties for tobacco use vanished. Peter the Great of Russia wanted to open Russia up to the West, so he legalized tobacco as a symbol of modernism. Japan and China gave up trying to enforce the prohibition on tobacco that the citizens obviously did not want. King James I put aside his personal disdain for tobacco when he realized the new source of revenue that could come from it. Early Spanish explorers ground the mixture of tobacco into a fine powder called snuff, placing it or sniffing it up into the nose and exhaling it with a sneeze. This custom, called snuffing, overtook smoking as the dominant European form of tobacco use. Sneezing was considered to clear the head of superfluous humors, invigorate the brain, and brighten the eyes. It also gave relief to the bad smells that were common in that time. The British colony of Virginia in America prospered greatly. Virginia tobacco would later be used to help secure a French alliance in the war for independence. In the U.S., snuffing was soon replaced by chewing tobacco, which freed the hands and was considered even more gross than before. In the beginning of the American Civil War, two trends emerged. Cigars were tight rolls of dried tobacco leaves that were smoked. A milder and lighter quality tobacco leaf was grown in North Carolina, where it is still the tobacco growing center in the United States. The second trend was the introduction of cigarettes, rolls of shredded tobacco wrapped in paper. British soldiers had adopted smoking cigarettes from the Turks during the Crimean War. Cigarette smoking became popular in Europe immediately, but was slower to take hold in the United States. The United States cigar industry was well entrenched. Cigarettes were seen as a lightweight or dainty version of a cigar. Cigars were marketed as more manly. However, with advances in tobacco making machinery, prices fell and tobacco gained popularity. Early feminist movement promoted women smoking cigarettes. Tobacco use became even more popular during World War I, as tobacco use often increases during times of tension. Celebrity endorsements helped tobacco industry growth, with cigarettes dominating. In 1964, cigarettes declined in usage after the U.S. Surgeon General reported on smoking and health that there was a link between tobacco smoking and cancer and other serious diseases. In 1971, all television advertising for tobacco was banned. In 1984, warning labels were required on all print advertisements and outdoor billboards. In the 1950s, more cigarette smokers chose to smoke filtered rather than unfiltered cigarettes in an effort to ingest less of the toxins in tobacco. By the 1990s, about 95% of smokers used filtered brands. The industry reformulated tobacco to a stronger blend with an increased tar content, which increased side stream smoke, which is more toxic from a filtered cigarette than from an unfiltered one for a non-smoker. Many smokers unknowingly covered the filter holes while smoking. Light and mild cigarette brands were introduced with lower levels of tar and nicotine, but people took more puffs, canceling out the decreased levels of tar and nicotine. In 2007, it was revealed that cigarette manufacturers had increased nicotine concentrations in tobacco from 1997 to 2005 by 11%. There have been many lawsuits against tobacco companies and challenges from federal government agencies. In 1993, the United States Environmental Protection Agency, or EPA, announced a conclusion from available research that environmental tobacco smoke, the side stream smoke in the air that is inhaled by non-smokers as a result of tobacco smoking, causes lung cancer. Most states, cities, and communities have enacted laws mandating smoke-free environments in all public and private workplaces. After allegations that cigarette companies had suppressed research that provided evidence of the harmful effects of nicotine and tobacco, the Philip Morris Tobacco Company reported that cigarette smoking causes cancer, heart disease, emphysema, and other serious diseases in smokers, and that it is addictive. In 1998, the major American tobacco corporations entered into an agreement with all 50 United States to resolve claims that the state should be compensated for the cost of treating people with smoke-related illnesses. The tobacco industry was to pay approximately $246 billion over 24 years and refrain from marketing tobacco products to those under 18 years of age, and pay $24 million annually over 10 years for a research foundation dedicated to finding ways to reduce smoking among youths. Less than 2% of the revenue collected by the states were used for the purposes envisioned by the settlement. In 2009, the Federal Family Smoking Prevention and Tobacco Control Act gave the FDA regulation authority over tobacco products sold in the United States in order to oversee the science-based regulation of tobacco products, the banning of candy-flavored cigarettes, full disclosure of ingredients and additives in tobacco products, aggressive moves to stop youth-focused marketing, and new graphic warning labels highlighting the health risks of tobacco. Many other nations have higher prevalence rates for cigarette smoking. American tobacco corporations may profit from foreign sales. Cigarette exports are major contributors against the U.S. trade deficit. When a smoker inhales, the temperature at the tip rises to approximately 1700 degrees Fahrenheit, as oxygen is drawn through the tobacco paper and other additives, resulting in a bright glow, oxidizing and releasing 4,000 separate compounds. A smoker inhales the result as mainstream smoke, usually screened through the cigarette filter and cigarette paper. There are two main components of tobacco smoke. The particulate phase consists of small particles suspended in the smoke, including water droplets, nicotine, and a collection of compounds that will be referred to collectively as tar, which is where carcinogenic compounds are found. The second component is the gaseous phase, consisting of gas compounds in the smoke, including carbon dioxide, carbon monoxide, ammonia, hydrogen cyanide, acetaldehyde, and acetone. Carbon monoxide is the most toxic. Carbon monoxide is an odorless, colorless, tasteless, but extraordinarily toxic gas formed when tobacco burns because the oxidation process is incomplete. Carbon monoxide attaches to hemoglobin in the place of oxygen and accumulates, resulting in a slow but effective asphyxiation of the body from lack of oxygen. Carbon monoxide is the primary culprit in producing cardiovascular disease among smokers, as well as in causing deficiencies in physiological functioning and behavior. The quantity of tar in the cigarette varies, but it should be noted that the last third of each cigarette contains 50% of the total tar, making the final few puffs far more hazardous than the first ones. The major problem with tar lies in its sticky quality, not unlike that of the material used in paving roads, which causes it to adhere to cells in the lungs and airways. They deter the functioning of cilia that cleans air intake, leading to carcinogens reaching the lungs. Nicotine is a toxic, dependence-producing psychoactive drug found exclusively in tobacco. A few drops of pure nicotine would quickly kill a healthy adult. It is commonly used as a major ingredient in insecticides and pesticides. Inhaled nicotine is absorbed rapidly and easily passes through the blood-brain barrier, as well as through the blood-placenta barrier in pregnant women. By the time a cigarette butt is extinguished, the levels of nicotine in the blood have peaked, and its breakdown and excretion from the body are well underway. The elimination half-life of nicotine is approximately 2 to 3 hours. The presence of ammonia as an additive in the tobacco blend speeds up nicotine absorption. The primary effect of nicotine is to stimulate CNS receptors that are sensitive to acetylcholine, releasing adrenaline, which increases blood pressure and heart rate and inhibits the gastrointestinal system. Many smokers reportedly were more relaxed due to the effect of nicotine on the brain that promotes a greater level of clear thought and concentration and reduction of muscle tone so that muscular tightness is decreased. Cigarette smoking helps sustain performance on monotonous tasks and improves short-term memory. Nicotine stimulates the release of dopamine in the nucleus accumbens and has a strong likelihood for dependence physiologically and psychologically due to its quick reaction time and its many environmental triggers. The titration hypothesis of nicotine dependence is the idea that smokers adjust their smoking behavior, to obtain a stable dose of nicotine from whatever cigarettes they are smoking. In other words, people who are given cigarettes that are lower in nicotine smoke more. First-time smokers often react to a cigarette with a mixture of nausea, dizziness, and vomiting. This disappears after tolerance increases. Withdrawal symptoms include a smoker's heart rate and blood pressure decreasing. Over the next 24 hours after the last cigarette, a smoker will commonly have a headache, an inability to concentrate, irritability, drowsiness, and fatigue, insomnia, and other sleep disturbances. They will have strong feelings of craving for cigarettes that may linger for months. Cigarette smoking is considered to be one of the hardest drugs to quit. 500,000 deaths each year are attributed to tobacco use or secondhand smoke. Smoking-related deaths account for nearly 1 out of every 5 deaths in the U.S. every year, more than 1,200 deaths each day. Life expectancy is shortened by 14 minutes for every cigarette. Unlike alcohol, which presents no significant health hazard consumed in moderation, tobacco is a dangerous product when used as intended. Cardiovascular disease can include several specific conditions, such as coronary heart disease, in which the heart is damaged by the restrictions of blood flow through narrowed or blocked coronary arteries. Arteriosclerosis involves the walls of arteries hardening and losing their elasticity, while arteriosclerosis involves fatty deposits inside arteries impeding blood flow. Ischemic stroke involves an interruption or reduction in blood flow, causing damage to the brain. Smoking is responsible for about 30% of all coronary heart disease deaths. The risk of CHD, or coronary heart disease, doubles if you smoke and quadruples if a person smokes heavily. Risk of sudden death is quadrupled. About 10% of all Americans now living may die prematurely due to smoking. The major problems are nicotine and carbon monoxide. Nicotine, a stimulant drug, increases the contraction of heart muscle and elevates heart rate. Nicotine causes the constriction of blood vessels, leading to a rise in blood pressure, and also increases platelet adhesiveness in the blood, resulting in platelets clumping together and increasing the risk of developing a blood clot, which increases risk for a heart attack or stroke. Chronic obstructive pulmonary disease, or COPD, refers to several conditions in which breathing is impaired because of some abnormality in the air passages, either leading to or within the lungs. 80 to 90% of all COPD cases are the result of smoking. Examples of COPD are chronic bronchitis, in which excess mucus builds up in the air passages, leading to an inflammation of bronchial tissue; emphysema, in which air sacs in the lungs are abnormally enlarged and air sac walls either become inelastic or rupture, leading to extreme difficulty in inhaling oxygen and exhaling carbon dioxide. In advanced emphysema, more than 80% of the patient's energy is required merely to breathe. Cigarettes cause airway obstruction and slow growth of lung functioning in younger populations as well. They make it 40% more likely to develop asthma and 30% more likely to have symptoms of wheezing. Although boys report smoking more, girls have greater loss of pulmonary function. 80% of lung cancer cases in the U.S. are due to smoking. Male smokers are 23 times more likely to develop lung cancer than lifelong non-smokers. African American males are 35% more likely to die from smoking than white males. Like COPD, lung cancer was traditionally a male issue, but is increasing among women, with lung cancer exceeding breast cancer as the leading cause of cancer deaths among women. Due to the tar disrupting the ciliary cells in the bronchial tubes, the lungs are open to attack. Several carcinogenic compounds in the smoke can now enter the lungs and stimulate the formation of cancerous growths, carcinomas, and lung tissue. 30% of all cancer deaths in the U.S. have been linked to smoking. There's also cancer of the larynx, mouth or lip, bladder, pancreas, kidney, or uterine cervix. Smokeless tobacco in the form of chewing tobacco or snuff does not prevent the user from risk of cancer. Instead, smokeless tobacco may cause leukoplakia or erythroplakia inside the mouth or nasal cavity. Compounds called nitrosamines, are present in all tobacco products. Women who smoke have more than 3 times greater risk of dying from stroke due to brain hemorrhaging and an almost 2 times greater risk of dying from a heart attack. Tobacco has a toxic interaction with birth control pills. There is a risk of low birth weight and physical defects in the newborn of a mother who is smoking. Babies of smoking mothers have increased blood pressure. More than 1 in 6 expectant mothers smoke cigarettes, with 22% of them smoking during the first trimester. Environmental smokers sidestream smoke may be more dangerous to the non-smoker than to the smoker. It raises the risk of heart disease by 25 to 30% in both men and women, and lung cancer by 20 to 30% among non-smokers who live with the smoker. Environmental smoke is the cause of sudden infant death syndrome, or SIDS. Among children of parents who smoke in the home, there is an increased risk of lower respiratory illnesses such as bronchitis, middle ear disease, wheezing, and childhood asthma. In 2011, 22% of people smoked a cigarette within the last month. American Indians and Alaska Natives are more likely to smoke than any other group, with 37% of adults defined as smokers. Asians are least likely to smoke at 12%. Smoking prevalence has declined among college students. It is generally considered that if high school seniors have not been smoking, it is unlikely they will do so in the future. 18% of 8th graders reported they had tried cigarettes, with 2% smoking daily. The cure for starting to smoke has been reported being, the onset of smoking has been reported to be 7th grade on average. Young people have become less accepting of cigarette smoking, with 88% disapproval rate. 80% prefer to date non-smokers. Since 1997, all 50 U.S. states have established 18 as the minimum age at which tobacco products can be purchased. There is a push to change the minimum age to 19 or 21 to decrease seniors buying for their younger friends. Smokeless tobacco is ingested by absorption through the membranes of the mouth rather than by inhalation of smoke in the lungs. The two most common forms are traditional loose-leaf chewing tobacco and moist, more finely shredded tobacco, called moist snuff, or simply snuff. Snuff is now placed inside the cheek or alongside the gum under the lower lip. Some varieties are available in a small absorbent pack sack so that tobacco particles do not get stuck in the teeth in a process called dipping. Although 80% of 8th graders disapprove of others using smokeless tobacco, only about 40% participate in this form of tobacco use. Moist snuff has increasing sales of late. Generally, a user will begin with a light nicotine snuff and increase to a more potent brand. Despite health risks and warnings, the popularity of smokeless tobacco persists. It may cause gum disease, damage to tooth enamel, and eventually the loss of teeth, oral cancer, stomach cancer, urinary tract cancer. A new form of moist snuff is called snus and is marketed as mess-free and spit-free. Cigars made a comeback in the 90s, largely due to images and media stars. Cigar smoking is dangerous due to nicotine being absorbed directly through tissues lining the mouth, and risk of lung cancer being 5 times higher for those who smoke cigars than for non-smokers. Cigars are eligible for FDA regulation, but are not regulated. U.S. tobacco is a huge export at $6 billion per year. There's less regulation and concern in other countries. 40% of countries in the world still allow smoking in hospitals and schools. Many countries that import tobacco base their economies on the taxes. If a smoker quits, some of the damage can be undone, with carbon monoxide levels decreasing, chances of heart attack decreasing, improved circulation, increased breathing ability, decreased risk of coronary heart disease, risk of stroke, lung cancer death rates, and coronary heart disease. It is easy to quit smoking for a short while, but is difficult to avoid relapse. About 1/3 of all smokers in the U.S. try to quit each year, with 3 to 5% success rate on their first attempt, and 50% success rate after 8 attempts. There are many options for smokers who want to quit. There are social support groups such as Smokers Anonymous. There is in-person counseling or telephone counseling, hypnosis, acupuncture, specific prescription drugs to help with your withdrawal symptoms and feelings of nicotine craving. Wellbutrin was developed for depression, but has been used very successfully for smoking cessation under the name Zyban, with 23% success rate, about twice the placebo. Chantix has been even more successful than Zyban. Side effects to Chantix and Zyban may include risk of serious mental health events, including changes in behavior, depressed mood, hostility, and suicidal thoughts. An alternative route of ingestion for nicotine avoids inhaling carbon monoxide and the lungs. Options may include chewing gum containing nicotine, or transdermal nicotine patches, or even nasal spray inhalers. It is suggested that physicians tell people their lung age, which increases likelihood to quit by 200%. Thank you. I'll see you in Chapter 11.